Do you have IBS? Today, we are addressing this condition that affects millions worldwide. It is Irritable Bowel Syndrome, or IBS. So what exactly is IBS? This chronic digestive disorder presents with symptoms such as bloating, cramping, diarrhea, constipation, or a fluctuating combination of both. Identifying your specific type of IBS is the first step toward achieving effective management and relief. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and IFM-certified functional medicine physician. So what are the different types of IBS? IBS is classified into four primary types. IBS-D, or diarrhea-predominant IBS, is characterized by frequent, urgent bowel movements. Common underlying factors include gut microbiome disbalance, food sensitivities, for example, to dairy, gluten, and infections such as, for example, chronic small intestinal bacterial overgrowth or SIBO, and all of which can trigger excessive gut motility and inflammation. The next one is IBS-C, or constipation predominant IBS, that is marked by slow-moving digestion, hard stools, and bloating. This form may be associated with inadequate stomach acid, thyroid dysfunction, low magnesium levels, or neurotransmitter imbalances that disrupt the normal bowel function. IBS-N, the mixed type, fluctuates between diarrhea and constipation, often making symptom management in those patients quite challenging. Contributing factors include, again, imbalanced gut microbiome, immune system dysregulation, and high stress levels that disrupt the gut-brain connection. The last one is post-infectious IBS that develops following a severe gastrointestinal infection, leaving behind chronic inflammation, microbial imbalances, and in some cases, autoimmune reactivity that alters digestive function long-term. But what causes IBS in the first place? A functional medicine approach seeks to identify and address the underlying root causes rather than merely suppressing the symptoms that sometimes we do in conventional medicine. So let's talk about gut microbiome first. The gut microbiome plays a crucial role, and an overgrowth of harmful bacteria, fungi, or parasites can severely impair digestion. For example, overgrowth of harmful bacteria leads to fermentation in the small intestine, resulting in bloating and discomfort, while fungal overgrowth, such as Candida, can contribute to sugar cravings, fatigue, and further gut dysregulation. So think about it. The cause of your fatigue may be Candida in your gut. However, it's not the first thing that a conventional doctor will think about, so it may take a long time and many tests and labs to actually get to this diagnosis. And meanwhile, the patient is still suffering. And that is the reason why one of the first tests that we run at our functional clinic is gut testing. Another root cause is food sensitivities. Those may include dairy, gluten, soy, certain fruits, vegetables. Essentially, any food can become a culprit. These foods often trigger inflammatory responses that exacerbate IBS symptoms. Food sensitivities could be determined by an elimination diet or by food sensitivity testing. There are many specifically studied food sensitivities, and I cover that in depth in my book, The Clear Skin Diet, Unlocking the Secret Link between the food sensitivities and skin health. One of these subtypes of food sensitivities is, for example, histamine intolerance, where foods like fermented products, alcohol, and aged cheeses provoke digestive distress, and they can play a big role in IBS. Now, back to root causes. Another big root cause for IBS is, of course, leaky gut. This condition occurs when the intestinal lining becomes compromised, allowing toxins and undigested food particles to enter the bloodstream. And this fuels systemic inflammation, exacerbates food sensitivities, and contributes to ongoing digestive disturbances. The next common root cause of IBS is stress. I'm sure you're not surprised. The gut-brain axis is a very big component. Chronic stress increases cortisol levels, which in turn alter gut motility and create an environment that is conducive to IBS symptoms. Effective interventions include stress management techniques such as deep breathing, vagus nerve stimulation, meditation, and also supplements such as adaptogenic herbs to regulate the nervous system and support the digestive balance. Next is, how about nutritional deficiencies as a cause for IBS? Absolutely. Magnesium, zinc, B vitamins, for example, are essential for muscle function, enzymatic activity, and for digestion. Deficiencies in these nutrients can impair gut motility, leading to constipation, bloating, and discomfort. So the last one, and probably the most important one, is as a root cause of IBS is bad diet. And what do we call, what is a bad diet? A bad diet in functional medicine is SAD diet, which is actually stands for Standardized American Diet. And unfortunately, it is a diet that is very high in ultra-processed food, high in simple sugars, in fats, and low in fiber. So the first thing that we do when we actually see a new patient regarding their gut issues or other issues that could be related to gut, because there are lots of issues, not only skin, but like we mentioned, fatigue, headaches, joint pains, and many others that are related to your gut issues, is of course, we talk about their diet. And starting with decreasing processed food, decreasing simple sugars, increasing fibers in the forms of fruits and vegetables, drinking enough water. All of these measures are as important as the ones that I described earlier, because without changing your diet, you can't really cure your IBS, because that's the fundamental, the most important step. Well, thank you so much for watching. Please don't forget to like, share, and subscribe. Until next time, bye-bye.